Professor Aslam will be joining us soon. Meanwhile, I would like to discuss about the basic SAS and clinical SAS aspects of the program. So basically, once you are enrolled, once the modules of data mining and machine learning or aspects are completed, then you will come to the SAS portion. As Professor Aslam has explained, we will be dealing with the base SAS, the basic concepts like how a data set has been written, how do you import the data sets from different formats like XML and Excel formats into SAS format. Once you get the clinical data in the SAS format, then the professor will go to the advanced SAS program. He'll explain you how to do the statistical procedures, macros, and when it comes to the clinical SAS, he'll mainly focus on CDISC, ADAM, and STTMS standards of clinical data. Okay, I hope everybody knows it, and once you learn clinical SAS with STTMS standards, then just basically to explain, there are two different formats of SAS data flow which is happening from ECRFs and raw data sets. And all these data sets, the information has been collected into a module called study data module, that is STTM. And in that you will see formatting into SAS format, and you will make the raw data compiled into a clinical data. Once this clinical data is logged and the tabulation has been done, the reports would be sent to FDA. The main goal of SAS is FDA reporting. All the clinical data which is obtained in the trial will be collected and presented in the datasets forms for the FDA. That's the main role of SAS. Once the basic 15 weeks of the SAS program is completed, you will also learn the basics concept of data visualization. Professor Dawal is the faculty for this, and he would be explaining you how to import data, how to manage the charts, how to do the visualization, editing, modifying, creating reports, and dynamic results of the data. As the data visualization mostly focus with the tool called Tableau, and we will be giving you a right for downloading. We have a license for Tableau, and you will be working on it with around 30 to 40 hours around Tableau. And both, as you know, SAS and Tableau both are the representation of the clinical data. They act as an for extracting FDA reports and exploration in various dimensions in data visualization. Okay. And after completion of all the modules like clinical research, data management, machine learning with R, data mining with R, machine learning with Python, and SAS, basics concept, advanced concepts, and clinical SAS portions, then you will go with an intensive training on internship. This internship consists with one of our global industry partners, and this internship is mainly focusing on SAS projects, and it does have three main projects there. First project is analysis data set development, and the second project is QC and STTMA data set development, and the third one is QC, adverse events, and demographic data tables. In clinical research, demographic data is the biggest data set you're going to deal with. And in project 1, to talk precisely, all the concepts would be explained in the class, and then you will implement as a project. So they directly give you raw data sets, and they'll ask you to formulate into different data sets which are represented to the SAS. So as a SAS programmer, you need to take the input files in the SAS format and give various tabulation, derivatives, baselines, and related variables and various sequential identifiers with this program. Okay. In the second project, you would be doing quality control and STTMA data set development. Again, we mainly focus on demographic data sets here. In the class, Professor Aslam will explain you how to deal with the data, And in the project, you will be implementing all the techniques in generation of demographic data and raw data sets, as well as mapping with the standards of FDA. Okay?
Hello, can you hear me?
Uh, sorry about that. Professor Aslam?
Yeah, I'm here. I'm back.
Yes, yes,
Can you hear me?
Professor Aslam. Yeah, on behalf of you, I'm just explaining them the projects of SAS. I'm just explaining the second project. You can take over from here. Thank you.
Okay, great. I mean, you can continue. I think you're doing a fantastic job.
Thank you, Professor.
Anyway, I will do that right now. All right, thanks, Geeta, for explaining the first project already. So I think what I can talk to more about this is that in the context of how this is used in the pharma industry, standardization, which is what Geeta was talking about, the CDISC standardization, which includes SDTM and ADAM, is a pretty hot topic in the pharma setting. Because of the fact that there are not, first of all, that many people who really understand standardization out there. And it's been now recently mandated by FDA for almost all companies to submit their data sets and reports in this standard. And which means that there's no company that can make an exception and circumvent this process. So that means what this means directly is that there's a huge potential for getting into this field and probably pursuing this as your career path. So how this also ties back to SAS programming is again very interesting because SDTM and ADAM, they're all those standards, and it's very good to understand how they work in the pharma setting. But the way they are created and the way they're made is, again, the underlying tool is SAS programming. And for the fact that FDA demands that the transport files, which are kind of, imagine them to be the only files that FDA accepts, the file format that FDA accepts is the SAS-defined XPT format. So if you decide to submit tomorrow to FDA in, let's say, Oracle formats or Excel sheets or anything, they will basically throw it back at you. So the only way right now they demand is in SAS format, which is a good advantage for SAS as a tool. And if you know that, then probably that means that you have a job secured as long as FDA mandates that need. So CDISC is a very good area to be in to understand that, and it's a fledgling field, meaning it's just still developing. There are still standards that are being created as we speak. And if you're interested to really understand how they work, there are standards out there on cdisc.org that you can take a look and probably think of pursuing this as your career. So what we do here is, at the conclusion of this course, after you have excuse me, learned all the SAS programming and how it is used in the pharmaceutical setting, we end it with these three projects that Geeta, I think, spoke about, the first two. So we ensure that you go through these three projects, which are kind of very nicely designed in a way that you'll be getting hands-on training, first of all, in not only just doing the SAS programming and doing hands-on programming with SAS, but also working with actual CDISC standards themselves. So you'll get an understanding of how to use the CDISC mandated implementation guides, how to interpret them, how to work with them, and what do they really mean. And that is what part of the coursework will deal with in trying to understand, going through all those implementation guides. And then it gives you an opportunity to apply them in real life setting. And in fact, this is an opportunity for you as part of an internship that you can really play around with. So these three projects, I think the first two have been explained. So the last one here, what is being spoken about here is the QC of adverse events and demographic tables. So if you're not aware of what those are two different kinds of tables or reports, call it whatever you want in the pharmaceutical setting. And what usually happens is when you write SAS programming, there's usually another person who kind of verifies your work, whether you have done it correctly or not. So that process is called the QC, or the quality control, wherein a double programmer is verifying all your work. That is just to ensure that the work has been correctly done. It's not to question your abilities, but that's the way it is designed in the pharmaceutical setting because of the criticality of the data and the reports. So you'll be working with this data set, in fact, these two data sets, and working with the quality control aspects of it. and ensuring that your programming, well, in fact, the other programmer who has done this has done it correctly or not. So that's what this project is going to be dealing with. And the first two were, of course, again pertaining to SGTM and ADAM as well. And I think this slide speaks about the duration of the program with the internship, which is 3 months. So that's good enough time for you to practice around with SAS and get accustomed to the series standards. And it puts you in a good footing to get into the industry and start working in the real jobs. And Gita, I don't know if you want me to speak further regarding the class schedule. I'm not sure if you explained them. On the weekdays, in the evening?
Thank you, Professor Aslam. I'll take on from
okay.
here. Thank you.
Sure, yeah.
Once again, thank you, Professor, and thank you, Pawan, for explaining about SAS and all the tools in internship. So while coming to the duration of program, as it's written there, you will have a 5 months exclusive theory and practical knowledge of various learning tools during the program, along with the 3 months of internship. And just to give you a heads up, there will be weekday classes and weekend on Saturday. Every weekdays, the classes would be held in the evenings. They start around 6:30 and may extend until 9:30 p.m. EST because most of our students are working individuals. And once again, it's hybrid programs. If you are in and around New Jersey, you cannot come and take the classes at Solace, or if you are out of the state, you can definitely take hybrid as a WebEx. All our classes are scheduled in WebEx platform and they are recorded also. In case if you miss 1 or 2 classes, you can always go back to the recording and listen to the classes. Once you are enrolled in the program, they'll give you access to the software by step. If you are working with R, Professor Pawan will help you to download R and Python tools. As well as when you are taking SAS sessions, we will be helping you with the SAS software. You will receive 1 year license for the SAS software from Solace. And there are also assistant faculty available for you for one-on-one sessions. If you're not able to, you need some extra hands-on practice with the tools, we'll have lab hours scheduled for you. And definitely we'll be able to answer all your questions during the classes. And I hope that's for today. And this is just a small overview of the salary range of a data entry level positions. And any questions regarding the program content, because the subject matter experts are along with us, please let us know any questions. So they'll be answering.
I see a question there. I see a question, is there any additional certification required, particularly for SAS, other than this? So the answer to that question is, there are, first of all, SAS offers 2 certifications, just for programming though. I mean, they offer many of them. One is the base and one is advanced SAS programming. So as a prerequisite to get into the industry, those are not necessary items to get into it. But if you have them and if you could put them on your resume, certainly it does have an added benefit. So if you can plan for getting those certifications at the conclusion of this course, then maybe it could be helpful, because all those topics will be fresh in your mind and certainly makes you capable of clearing those certifications very soon.
Yes. Thank you, Professor Aslam. Any other questions, please feel free to send us in the chat box so we'll be able to answer. Is there a course focusing only on SAS Clinical? Definitely admissions would be giving, will be able to answer that question, Deep. Please reach out to admissions@solace.edu. They'll be giving you the outline and curriculum of the SAS program. Okay? So what about the placements of this course? It's a very good question, Indu. As Solace, we always support our students in career aspects. So we do have a separate careers department for us. And that career department, they conduct 3 to 4 sessions while you are in the course. they'll help you with preparing your resume and preparing for your all the interview preparation and the tips and tools which needed for the placement purpose. Uh, and once the session has ended, you will be receiving a link from us with our summer careers department. Once you are enrolled, they'll give you a schedule of all resume interview preparation sessions. They'll be talking one-on-one with you, and will be helping towards the placement in the course. I hope that addressed your question. And any other questions? What if you work full-time? How will you be able to complete the internship? And many companies prefer candidates with statistics experience from the data for the data scientist role. I think Professor Aslam, you will be able to answer this. It's from Shiva. Do companies prefer candidates with statistics experience for the data scientist roles? Hello?
Hello, can you hear me?
Yes, Professor Aslam.
Oh, sorry. I already gave the answer when I was mute. Okay. Hello. Okay. So let me go in order. I think the first question was, what if you work full-time? How will you be able to complete the internship? So I think the answer to that is that, as Geeta mentioned, this internship is online, so which means that you are free will to pretty much work on it at your free time. And I'm assuming if you're working full-time, that means 9 to 5, and that means you'll have time probably in the evenings to work upon it. And that gives you this capability to work anytime you wish. And that's why there's no mandate that you need to be from 9 to 5 for this internship, I believe. So you're at least not in that time frame. Okay, going to the next question. Do companies prefer candidates with statistics experience for the data scientist roles? Well, at least from the life science standpoint, from if you're planning to use SAS programming as your skill set to be able to get into the pharma setting, then statistics degree is certainly an added benefit, but certainly not a prerequisite, I should say, because I don't have a statistics degree. As long as you're able to work with the SAS programming aspects and understand the life science settings and the concepts within it, then I think you should be good enough. So it's certainly not a requirement for you to have statistics degree. But certainly if you want to flourish and prosper in your in that particular role, to take on additional roles, like if you want to become a biostatistician or something, then yes, maybe you might need those degrees. Any advantage for Tableau or Spotfire? Well, like I mentioned during my introduction about this, we will be needing the visualization. In fact, we will be learning the visualizations and reporting aspects that are involved right within SAS programming itself. So I haven't seen any companies really mandate that you use Tableau or Spotfire or Click or any other visualizations tool at this point to use along with SAS, because SAS itself has this inbuilt capabilities to report and generate beautiful visualizations. So I don't think there'll be a need for that. But unless FDA demands certain reporting things, then yes, you might need those. But yeah, if you have those skill set, that's well and good. Geeta, back to you.
Thank you, Professor. Okay, any other questions from any of the students?
So if there are none, then I'll probably end by wishing you all the best. And hopefully we'll be, yeah, go ahead, Geeta.
One more question, Professor. Any incentives for internship?
Incentive meaning what?
They have
Incentives for
Goodreads
internship.
has written like any incentives for internship. Can you please elaborate, Goodreads?
Well, if they mean the benefit of internship, doing internship, then yes, there is, because you're now applying all those concepts that you learned theoretically, in fact, hands-on, into a real-life practice setting, then yes, that's the biggest incentive, I should say, to continue taking the internship. But if they mean, are you paid internship, then Geeta, I'll leave it to you to answer.
No, it is included in your course along with your program. Will award with an internship. It's included in the program. It's not out of the program.
No, I mean, they could have meant, are you paid for internship as a salary?
Oh, salary? No, it's not. It's an unpaid internship. It's not a paid internship. Okay, thank you.
So I see a question come up recently, to what extent do pharma companies are using machine learning and data mining techniques for clinical trials? I think as has been explained in this past 1 hour, I think the indication was that a lot, especially in the past few years, yes, they are moving in that direction to, I guess they're kind of saturated with their old methods of going the regular traditional route. So now they want to explore into what machine learning and data mining can provide. And in fact, artificial intelligence can do in these areas. So at least I have seen companies recently go into that realm and work with tools which we haven't even thought about using them for the past 2 years. So yes, the answer to that question is they are getting into this, and you'll see that trend continuing.
Thank you, Professor Aslam. And I think Dr. Praveen here would be the best person to answer the question, as he is currently working in pharma company.
What's the question?
It's like companies using machine learning data mining techniques for clinical trials.
To what extent? Good question. It depends on the companies. Like, now, I mean, like some are preliminary in discussion. Some of them already started those trials. For example, like I cannot give the direct information, but in my experience working with different companies with my vendors, we use those artificial intelligence firms for, we call it as SPA, special program analytical teams. Where, for example, if I want to go for a very a unique population, unique, I can say, orphan disease, where it can affect fewer than like 4,000 patients in the United States. But I don't know whether the historic data, whether I have, probably as an organization, we already did that work, but when it comes to the global feasibility, myself, and senior management too, from the senior leadership team, we will see like how better we can get the patients. Do we need to go to the United States or through global? And when it comes to searching those, we use those technologies to see what are the sites we have in mind based on our due diligence team, SPA analytical team, and also the historic data within our organization, and also the publicly available information outside of the domains. And then we compute that into a dashboard, present it to the senior management to see what is the best approach, to stay in-house, to go global. It's one that I give as a one reference, but a lot of companies are using all these technologies, especially as I mentioned in the earlier too. Like it's very important for us to understand whether this particular trial can be executable or not. That's the global feasibility, and then go to the credible sites so we can jumpstart. Because therapeutic area leaders, they want to dose the patient ASAP, and we cannot. I mean, like there are regulations in place, but when we, from a clinical standpoint, we also see the competition. Like, if they are dosing their first patient in clinicaltrials.gov, they say like probably a couple of months from now, I want to beat that too, because I want to go into the same timeline so that I can submit to the FDA before them, especially we are competing with the same target. I hope I answered that question from a business level.
Yes, Dr. Praveen, thank you very much. Thank you very much, guys. And any questions, please feel to reach out to our admissions team.
Just want to let you know, I see a very diversified group of colleagues. I don't say students, colleagues here. If you see the program, this is some of them ask about the regional accreditation. We are a federally accredited institution. That's from a business side, we as a Solars College. But I just want to mention that the program itself, if you see, a lot of companies, they see it's like a fancy program because any platform I go to, from an executive board to local ACRP chapter meetings to company organizations to the business level meetings, I hear these words a lot. But there are very few programs where they include all these into and give the name to the program as a clinical data science, as our colleagues also explained, like how it's going to really help different domains. I see people from different backgrounds, but again, as I said, you already have some kind of dotted line experience with IT, some already have with therapeutic areas, some with life sciences. But with your background and with this education and the hands-on internship program, probably you can open your doors for much more lucrative career opportunities to start with. Then, based on, I see PhDs here, masters here, then I will take this as a stepping stone and then get experience in this and then move up the ladder pretty fast, because operations and especially data management, you have better career chances to go up the ladder faster than some of the other scientific training courses. So again, it's not like no one is promising you a job. If someone is promising a job, they are lying and you are lying yourself, because we are all know this industry is about research. So go through the same systems outside, see your due diligence, and do your own research and see how your background, your education, your competency, your skill set added to this program can give a better value proposition, and see if it is something that you want to pursue, to see where you want to see yourself taking this course and get a stepping stone into the pharma industry. But whichever decisions you want to make, good luck to you. But if you choose to decide to come in, we are more excited to work with you folks. It's like knowledge sharing, we share. Even when you teach, it's an everyday learning curve. And how are you going to learn? That's a program learning, right? So that's a smart way. That's what artificial intelligence and machine learning is like. You program it, you see it based on observations. Then you need to extract it when in terms of need, so that you don't need to do again and again to avoid redundancies. So apply the same principle for your research, and let us know how we can help you to fill the gap in your career and also to get a job. It's crystal clear. Like, everyone joined this session because you're looking for a career opportunity. If you are working, you want to go for better prospects. If you're not working, you want to get a job. So check it out and let us know how we can be of help. It's nice talking to you folks, and I'm very pleased to talk to such a diversified colleagues with different educational backgrounds. Thank you and have a good night.